Good morning again. I hope you guys all enjoyed looking at the posters downstairs, and now we get to dive into a little bit more of what we've been doing here at Calgary. My name is Eva Wasniewski. I am the Director of Domestic Programs at the Continuing Education. Tim Wilson is sitting right there. Many of you might have gotten emails from him on and off. He registers you, he makes sure that your systems work, all of that good stuff. I'm going to be presenting with Ingrid, your fearless instructor. And we just wanted to share a little bit for those of you who aren't as familiar with the PaCER program, what the program is about before we dive into some of the presentation. So overall, the program is a 12-month non-credit online certificate program. The nice thing about the non-credit piece is we actually have kind of an open admission criteria. So many people can actually access the program. You don't need prior education before. So we are able to support you as you work through it. We are delivering this through the University of Calgary Contact Continuing Education, which I am from, with Alberta for Support U, the patient engagement team, which I believe Maria, Paul, and Ingrid that I work with on a regular basis are from. Maria is the scientific director. I'm the operational director. And we really are focusing on teaching patients, or we teach patients and community members to conduct this qualitative research. We do this with them, with the communities, with the healthcare research topic, and a matter as we move forward. The other thing that we like to make sure that we're doing is we're trying to move towards a 2 intake process. So we have something more in the fall and something in the winter. Most of our teams are 5 to 7 diverse members, and they are sponsored by a funded clinician or academic researcher in order to be able to access the program. This is just a list of different sponsors that we've had for PaCER teams, as well as external funding sources that the researchers or clinicians were able to access. Some of the benefits that have happened at the very end, there is a final report. If you were a PaCER, which I see many of you guys are in this room, you guys know the pain, the tears, the sweat, the power of writing that final report and getting that all together ends up happening. Patients identify current best practices for future research priorities. This is a joint participation or participant recruitment initiative. We try to have a lot of inclusion and retention. I did have someone actually ask me downstairs, what is the drop-off rate or what is our retention of PaCER participants in the program? And it really depends on the team. Sometimes somebody has to step away and then they come back. And we really try to accommodate as much as we can. Once again, being a non-credit program, this really enables us to have a lot more flexibility in being able to support our students. Finally, we do some patient-informed pilot tools, data collection, analysis. We do the whole interview guide, so ethics is part of this. And then more appropriately, the universal knowledge translation, dissemination, implementation approaches. So we really are trying to train patient research partners with experience and skills in qualitative research practices.
So as Eva explained, PaCER is delivered in over 12 months and in 3 courses. It's delivered online. So course 1 is 10 weeks. Basically, we work on cementing the team, as well as teaching participatory health research methodology and giving the learners a chance to practice some qualitative research skills, such as academic literature reviews, research ethics board submissions, data collection. So we use focus groups and interviews, as well as thematic and narrative analysis. In course 2, the teams take their sponsors' very broad research topic and use an iterative process to distill and refine this to a specific research question. They then design and develop a research protocol to answer this question, finishing course 2 with a submission to the Research Ethics Board. There's a bit of a gap between course 2 and course 3, and in course 3, the students actually carry out their project. So what I mean by this is that they do their focus groups, their interviews, the thematic and narrative analysis. They identify some key themes and recommendations, and then they take all this evidence and they compile and synthesize it into a final report. They often also do oral and conference poster presentations. So this is just a quick breakdown of the course. So course 1 and course 2 are 10 hours. 10 weeks. Course 3 is 15 weeks. It takes a little bit longer as they're carrying out their projects. We hold the classes 1 or 2 days a week, usually between 5 and 7 Mountain Time, because that encompasses all the 4 time zones of Canada. And the classes are recorded for students that do miss the course or miss the class. And PaCER follows this very specific research approach of set, collect, and reflect, aiming to integrate the patient perspective at all stages of the research project. So again, these projects are patient and community member led as well. The set phase, the teams invite members of the public with lived experience as well as previous PaCER students to give final feedback on their research protocol before they submit to ethics. Collect is collecting the data through the focus groups and interviews. And then again, after they've identified key themes and recommendations, they share these back with the collect participants in a reflect focus group. So this is essentially the member checking, making sure that what the participants said is actually what's reflected in the results. And so PaCER teams, as well as PaCER projects, are guided by these 4 values of partnered research identified in Dr. Marlette's foundational textbook. So everyone is equal, but we all have different lived experiences, perspectives, motivations, the value of trust and trusting relationships, shared power, and shared work. So for our PaCER teams, we really aim for diversity in the teams. So while all the team members may share the lived experience with a similar health condition, they come from various backgrounds, academic and professional, social, cultural, different motivations for joining PaCER. And what they get in addition to the certificate that Eva was talking about is they have experience and an understanding of participatory health research methodologies. They gain an understanding of the additional perspectives and experiences of others living with their similar health condition. They get these skills in completing a final research report, as well as ways of more effectively sharing their research results. And as you can imagine, if you take a team of very diverse people and you ask them to work together for a year on a common project, they also learn a lot about self-awareness and collaborative and teamwork skills. And this is important because in 2014, so you've heard about the initiatives in Ireland and Sweden, and in Canada in 2014 as well, the Canadian Institutes of Health Research, CIHR, launched their strategy for patient-oriented research, asking that patients are included as active and equal research partners and at all stages of the health research cycle. So what's unique about PaCER researchers is that they have experience and understanding of all these different aspects of a health research project and processes. As well, they're effective mentors to other patient partners on research teams who maybe haven't been able to access or take the PaCER program. So you've seen some PaCER project posters downstairs. PaCER evidence can inform future research priorities and projects. It's great patient and community-centered evidence for informing future healthcare policy and practice. As well, the PaCER evidence is great knowledge for co-developing care pathways, educational intervention, and implementation tools. And as we've talked about with open science, we really want to make sure that PaCER processes and results are accessible to everyone and in ways that make sense to them. At the top here is Marcia, Bruce, and Jamie shared their publication at a recent patient engagement journal club. Deidre and Peter did an amazing 3-minute video about their project. And then you're going to learn a little bit more about this honoring life graphic representation in a few minutes. As well, there's several PaCER publications, and Eva's going to show you how you can access all those publications shortly as well. And Sandra Zielinski, many of you probably know Sandra. She was a PaCER graduate from one of the earlier programs. And Sandra's developed this great patient engagement podcast series. So she's listed here some previous podcasts that have involved some of the early members of the PaCER, as well as she's currently working on a PaCER series for the more current PaCER projects. So there's a QR code there. The URL is below it. And Sandra's also included her email. So please follow up with that. And then Christina, Kim, and Veronica have developed a PaCER community of practice. Here's their Facebook page. As well, we have a QR code and an email, and they have a table downstairs where Ava's got her swag as well. So please go down and check it out and consider joining and learning about the events that they've got planned for the PaCER alumni going forward.
So we were able to update and launch our new website just this past year. So right on the top, if you're interested in becoming a sponsor, there is more information on this tab, as well as there is an online form for you to fill in. Find some more research, you can just click on that one, which will pop down the 2 tabs below with the PaCER team projects as well as publications. And then we also have PRISM. We have a number of publications that are on the PRISM website of previous PaCER publications. A lot of P's. So just in summary, we are very excited that we're going to be able to turn this over to some of our PaCER grads to be able to share some of their different presentations. And really, when it comes down to it, we are very privileged to be part of this team and to be able to do this great work and to support and find a place and a space for some of this to be able to move forward. When you do come downstairs to the table on your way out, we are very happy to say we do have now little PaCER pens, as well as we have PaCER bags. So if you have not picked one up yet, please make sure you come by and grab one on your way out. Any questions? Oh.
Just a question, how do you keep people accountable in the PaCER program? So you have a team with like lots of people in it. How do you know people learn what you intend them to learn?
I'm guessing there's probably a few PaCERs that would have an answer to that one better than I would. But when it comes down to it is we do try to follow adult learning principles, and going back to gray matters and the 4 areas of value, we do try to hold each other accountable to it with compassion. And that's what it comes down to, is because everybody's going to be coming from a different place, different space. And since this is a year-long program, we have to make sure that we account for life. And so as that's happening, open communication, being straightforward, honest, transparent is the best way. But things happen, and then we'll just pull people aside to have different conversations to support that growth and that understanding. And at the end of the day, if we have the same vision and the same goal of trying to finish the program, to be able to share some lived experiences in this field, that's what we try to keep the focus on. Any other questions?
Yeah, thanks, Eva. What's the difference or similarities between PaCER and CPAR, just through action research?
Story action research, however, it's patient-led. So the patients are the patient and community members are the researchers as well. They get the experience at all the different levels. So they co-develop their interview guides, they co-facilitate the focus groups, they write the reports, they get the experience at all. Like they get the knowledge, but then they learn how to apply that knowledge at all levels of the research process. It is a participatory action research approach. It also uses a specific PaCER methodology, which is that set, collect, and reflect, which is unique to PaCER. Does that answer your question? Yeah.